how do you manage and recognize sleep disorders, Lindsay? How do you interpret those differences?
Well, there are all sorts of different sleep disorders. So insomnia, it's not just I can't sleep at all. Insomnia is when you either have trouble falling asleep, so statistically taking more than 30 minutes to fall asleep, say 3 or more nights a week, or being awake for more than 30 minutes in the middle of the night, or waking up more than 30 minutes earlier than your ideal waking time. But insomnia is one of many sleep disorders. So there's sleep apnea, where people can stop breathing during the night. And that's really, really very common and very underdiagnosed. And it's a very serious issue. So if you are watching this and you know that you snore, people have told you that you snore, and maybe your partner said, oh, you stop breathing during the night, and they give you a nudge, and or they'll say, oh, I love it. Sometimes you stop snoring for a bit and then you take a big gasp and you start snoring again. But I love those little windows when you're silent. That's those apneas when you actually are stopping breathing. And that sleep apnea is actually very dangerous. It puts a huge strain on your heart. And you might think that you've slept for 9 hours during the night, but actually you were woken up so many times, because every time you stop breathing, your brain has to wake you up to take a breath and you go back to sleep again. It puts a really big strain on your heart. Then you've got things like narcolepsy, which is fascinating, which is where you just fall asleep during the day without intending to. It's often in movies as quite a comical thing, but actually it's devastating. You can't drive. The only treatment is basically amphetamines. It's not a good thing to have. There's parasomnias, which are sleepwalking, sleep talking, sleep paralysis, which is where people wake up in the night and they feel paralyzed if they're unable to move. So they'll wake up, open their eyes, but feel like they're literally paralyzed. And it's the most scary, everyone reports being petrified. And this is fascinating sleep disorder, because across the globe, people report seeing a scary figure at the foot of the bed. And they'll say that they're paralyzed, and then they'll see a witch at the bottom of the bed, or the devil, or the Grim Reaper, or a ghost. And if you look back hundreds of years across all societies all over the globe, everyone reports the same thing. And I think it's fascinating, because even alien abduction reports can often be attributed to sleep apnea. To sleep paralysis, because someone wakes up, they'll say, oh, I think there was an alien in my room and he paralyzed me in the middle of the night. And what they're describing is sleep paralysis, which is, if you don't know what it is, it's absolutely very scary. And people can think they're having a psychotic episode, or there's so many sleep issues. But I treat insomnia, which is caused by anxiety, sleep behaviors that aren't helping you sleep. And then there's this whole other host of medical sleep issues as well.
That's fantastic. What a great answer. I suspect with insomnia, I would suspect that we all really will suffer that from time to time. I know certainly when I had tinnitus, and I still have it, but when it was at its worst, I certainly found sleep very, very difficult. I was only snatching at sleep, and quite often I'd have to get out from my lack of sleep and just go for a walk in the middle of the night to try and bathe in some sort of different reality. Because really, when you're really in the throes of tinnitus, it's really, really exasperating, very difficult to manage. And even just being away, at least being in some sort of fantasy land, even if it was outside in the dark, just walking, was really useful to me. And at least it made me so tired I could at least grab a few winks and get some sleep when I kind of really, really needed it.